I've got to say, it's been a real touching time. The 13,000 that we've lost from COVID and how this community's come together. It's just glorious to be part of it. A couple things I just wanted to connect before I'm going to go quickly through what is a few too many slides and get to what is a great part for the president at the end. It's just to connect a few dots for me with what you all have talked about. When everybody's talked about the teamwork and the partnership, and I always talk to other people about the culture of collaboration in Gwinnett. Yeah, I'm regional director for DeKalb, Gwinnett, and Fulton counties, 3 of the 4 largest in the Atlanta region. And there's nowhere in those places. I know you all hear about those places and hear Gwinnett is best. I go there. I meet with people like you and work with people like you all in all of those counties. And it's always, I'm lifting up the Gwinnett model. I'll call it the Gwinnett standard, of course, now. But the culture of collaboration is really what gave us the foundation to be celebrating today. Because if we had to start from 0 on collaboration when COVID hit, we wouldn't be here. And I've worked with other communities who were at practically 0 on collaboration. And the difference shows. The other thing I want to just say is, and I always tell other counties this a little bit, Gwinnett's my home. I've been here 30 plus years. So when you talk about knowing people's names and the personal connection, that's what it is for me. It's personal in Gwinnett and being a resident in that sense. Now I see, looking down at the book here, that people haven't been flipping the pages, but I'm going to keep up with this. Let me just start off. I'm just going to say a few things about each of these slides, going to about child well-being. And the last time we had a score about our child well-being index and where we are in Gwinnett on the 14 measures, 64.1, 2018. We're working with the Atlanta Regional Commission and Neighborhood Nexus now to reformulate based on the 2020 census. What's the new picture? COVID, is it better? Is it, who knows what that is? But just letting you know that in September, looking to come forward and sharing with you all with what is the updated picture and what does it mean and how does it inform what we are doing and what we'll do in the future. At the early formulation for this, one of the labels for this piece I was speaking to is about funding opportunities. So I wanted to say a couple words about funds, because funds fuel all of the work that we're talking about. And for us at United Way is 3 key paths of funding investments to get to outcomes, which is what all of you all are about. And that's our Child Wellbeing Impact Fund, the COVID-19 fund, which I think we stood up, it was about March 20th, I got the call, and it's like, we're gonna do this fast? We're United Way. We weren't the agile ones 2.5 years ago. And then, of course, with all that we've experienced collectively and individually, the United for Racial Equity and Healing Fund from the summer of 2020. So, last year at the glance, how did we do and how did that translate for us here in Gwinnett? We distributed $30 million over the 13 county region. You can see the other numbers from our Child Wellbeing Mission Fund. We raised from so many people that were wanting to do something to address the crisis. We raised more than $30 million with the COVID Response Fund and distributed nearly $28 million to the community. And not surprisingly, what you see here is the breakdown of the categories almost parallels what the crisis teams were here for Gwinnett Cares. And you can see what the breakouts are there. And it's just interesting how things, that were maybe being addressed from a regional standpoint aligned with what was crafted so well in terms of focus areas to address a crisis here in this community. In terms of the United for Racial Equity and Healing Fund, we've distributed almost $1 million, 6 nonprofits, focused really on learning and advocacy and civic engagement, because we've got to unite not just in terms of the health and human services work, but we've got to unite in terms of our society and in our community. So what's been the impact of all that when you think of that from a regional perspective here in Gwinnett in terms of impact? When you're when you're investing in so many different kinds of things, it's kind of like, what's the common denominator? You can't say people served, services offered, so we've come up with what we're calling interventions. 1.7 million interventions is what the COVID-19 fund supported here in Gwinnett. The Mission Fund, 32,000 served last year, and that's the feedback that we get from the grantees, many based here in Gwinnett, but also we support a lot of regional nonprofits that serve in Gwinnett as well. And then our 211 Service Contact Center, nearly 40,000 contacts last year from Gwinnett residents looking for help. And who do we refer them to? So many of them are you all and the great work that you all do in this room. So what's next? And I want to take just a couple minutes on this and get to end up about funding. Here in Gwinnett with United Way, there's three key things that we're looking at and are excited about coming into our new fiscal year, which starts in July. One is Spark Prize 2022. First Spark Prize Gwinnett was 2016. And so we'll be kicking this off, applications opening up in the July timeframe. For those of you who don't know, it's kind of a Shark Tank thing. New ideas, things that are being tried but need some fuel to scale, can win up to $25,000 for a nonprofit idea. There'll be a final event in October to make a pitch in front of judges. There's a card on our table that gives more information about that. There's been a thread through what many of you all have spoken to about equity. Equity in healthcare, equity in housing, so many different areas. That's part of what we collectively in the country and in our community have learned, is that so much of the crisis played out where the disparities and the inequities are. And that's why for us at United Way, racial equity has always been a factor because it so much correlates with child well-being. And so what we're trying to really plant and anchor and really provide a place and a focus in our community is around equity, inclusion, and belonging. And I've got to say the belonging word. I remember when I was sitting at this first, at Chairwoman Hendrickson's, Nicole, first State of the County address, and she said, we've got the diversity, we need the equity, inclusion, but that's not enough. It's also belonging. And that has always just stuck with me, that it's about belonging that we have to get to. Many of you, at least some of you I know, have signed up and are participating in the 21-day Racial Equity Challenge that started last week. Please check it out. It's individual. Do as much or as little as you want. We're excited to partner with others in the community, and we'll be starting up next month. This is still June. The work to find out what's the collective thread across our community in terms of challenges and aspirations. In every sector, no matter what you're talking about, the school system, public health, and so forth, equity is lifted up and people are focusing. There's the county equity plan and the Gwinnett Place Mall equity action plan. But what's the thread that comes across all of those sectors and ties us together? And so we'll be launching a community equity assessment, really looking to reach wide, not just in the sectors, but to the community and the residents, and to learn what are those key equity challenges, but what's the aspirations, so that we can bring those together and formulate a community equity plan. And so I'm really excited about that work. And then as the chamber is doing their renovation, it's given us an opportunity to rethink, what do we do with this space here in the chamber other than show up now, not very often, with remote work? And so what we're going to be doing is really opening up that space for it to be a resource for the community, an umbrella for this equity work. And so we'll be opening probably next spring, if the supply chain things kind of hold where they are now, the Gwinnett Center for Equity, Inclusion, and Belonging, and look forward to serving you and the rest of the community in many different ways. Now let me come down to the last part. One of the things I'm so excited about is our partnership with Gwinnett County in terms of the grant making for the ARPA funds that they're allocating to support nonprofits. We've partnered before on other things, but this is like just ultimate in terms of being able to bring together the best of partnerships and relationships. I've been so excited about being able to go deeper in relationship and work with Shannon Candler in terms of this work. And what I wanted to do is to give you the details. I know I've been asked about it on several Gwinnett Cares calls. I think it's that man over there. Denise, what can you tell us about the ARPA funds? And I said, not much yet. I'm trying to, I'm not going to get ahead of the county team. So the focus, and what you'll see that there was a press release today it's focused on programs and services, $4.2 million. Critical needs have been identified. It's what we've been talking about here today. But we know things are evolving, and we want to be very current in what those needs are. So each of you have it in your seat, or maybe under your seat now. There's a card here that has these details, and we're opening up today a digital listening survey. We have one survey for nonprofits and another one for residents and community groups. I think almost anyone here, you're almost all younger than me, know how to do a QR code, but this will take you to link directly to the survey. Please share it with everyone that you know, because the more voices and perspectives we have about what the critical needs are, the finer point we're going to be able to put on where and how these funds need to best serve the community. Applications will open on August 1st and be open until the 26th. It's great to be able to end on a note about bringing resources to the community in partnership with the county, and I'm excited about that. I'm also delighted now to shift gears and come back to health, mental health. Almost every conversation, mental health is not something that was somebody else's thing. It's collectively, we've all had challenges. So I'm excited to introduce Jennifer Hibbert.